If it's in Hampton Roads, it's on the Hampton Roads Show.
Carrie, Dr. Oz, thanks very much. Contacts and glasses will one day be a thing of the past. Here to tell us about one way to get you seeing 20/20 without them is Dr. Samuel Garrett with the Virginia Beach Eye Center. Dr. Garrett, welcome to the Hampton Roads Show.
Thanks for having me. I appreciate it.
I know you're a big proponent of this technology called NuSite, and actually you prefer that over LASIK. Can you tell us the difference between the two and why you prefer that over LASIK?
Right. So LASIK, originally when refractive surgery started using the excimer laser to reshape the front part of the eye, front part of the cornea, we used to do something called PRK, or photorefractive keratectomy, and that was a surface ablation. It was just using the laser to reshape that front part of the cornea. One of the problems we had with that was there was a lot of discomfort associated with that technique. And then we shifted over to LASIK, which is where we actually make a flap. It's kind of like if you think of this cornea like a book with 500 pages. We're going to open the book to page 140 or so and then do the laser underneath the flap.
Well, you actually cut into the flap.
Exactly. Okay. Make a flap in the cornea and then do the laser on the inside and then put the flap back down. And that worked very well, but as time went by, we saw more and more complications with LASIK flaps. There's really about 20 different things that can happen. Some are early, some are late. And so a lot of surgeons, including myself, are going back to the surface now, and we're calling it something different. In our practice, we call that NuSite Advanced Surface Ablation, and we're now finding that it's equal as far as the comfort level after surgery. Visual rehabilitation is actually quite fast with this, a little bit slower than LASIK, but it has all that safety factor of the surface ablation where you don't have to make a flap and have flap-related complications.
So it's kind of the more advanced technology of the first PRK.
It is, it is. That has gotten better and better over time. The medications are better, the contact lenses that we use, the lasers have gotten better, the way we take the epithelium off to do the actual laser procedure has all gotten better. So now there's quicker visual rehabilitation, there's more comfort after the procedure, and then again it's a long-term safety issue is really the key thing.
So who would be a good candidate for this NuSite technology?
Most patients that have surface ablation are between about 20 and 50 years of age, really concentrated probably around age 30, early 30s. And it's people that have nearsightedness of a low or moderate degree, people with farsightedness of a low to moderate degree, and astigmatism. Those patients can usually have surface ablation.
Now, for those folks who are interested in perhaps getting away from the contacts or the glasses, what are some important points to consider for those folks choosing an eye surgeon or considering refractive surgery?
Well, I think with the refractive surgery, you want to choose someone that's been doing it for a long time. When excimer laser technology was first developed, I actually brought together 23 ophthalmologists in 6 area hospitals, and we created something called the Laser Optics Center. That was the first place where we did excimer laser surgery in Hampton Roads. And so you want somebody that has a lot of experience, has been through all this stuff. I've been doing, you know, in the early days I did radial keratotomy and astigmatic keratotomy and all automated lamellar keratoplasty. There's all these kind of alphabet soup of techniques that we've used. So you want somebody that's been there and done a lot of surgery and been doing it for a long time.
Okay. Folks, I'm sure we'll have questions for you, so to get in touch with Dr. Samuel Garrett, you can reach him at the Virginia Beach Eye Center at 465 North Great Neck Road in Virginia Beach, or call the number on your screen, 481-5555. We'll link all that information, make it easy for you, at thehamptonroadshow.com. Doctor, thanks very much.
Thanks for having me.